Thank you, Mr. President. Mr. President, I'd like to associate myself with the remarks of the majority leader and point out that in today's New York Times, Wednesday, October 21st, big headline, "Insurance out of reach for many despite law." Despite this law, insurance is out of reach for many. And I know that my colleagues who are back home visiting with people around their home states last week, listening to what was on constituents' minds, heard exactly this: the problems of the health care law. I was home in Wyoming, heard from a lot of people very concerned about President Obama's collapsing health care law. And that's what this law is doing. It is collapsing. People in Wyoming just learned that the one insurance company, Win Health, will no longer be selling insurance through the Obamacare exchanges in our state. The company said it had to stop selling Obamacare plans because there was just no way to make money without big taxpayer subsidies coming from Washington. Now, Mr. President, this company was already planning to raise rates significantly next year, and it turns out that even that wasn't going to be enough money to make it worthwhile. Less than 2 weeks, Obamacare exchanges across the country will start now selling insurance for next year. So the total number of companies left selling insurance in the exchange for the state of Wyoming will be exactly one. One. There'll be no competition at all in the Obamacare exchange. If your doctor doesn't take that insurance, you're out of luck. If you can't afford it, you're out of luck. Is that how Obamacare was supposed to work? Is that what the president promised the American people? Now, I got an email from one of my constituents yesterday, Al Harris, great guy, Green River, Wyoming, and he wrote, "Help," in capital letters. Capital H, capital E, capital L, capital P, exclamation point, exclamation point, exclamation point, exclamation point, exclamation point, exclamation point. He says, Win Health has become the latest casualty of Obamacare. Al says that at his business, he says, I have about 30 people that now will have no insurance, at least not this insurance. I'm scrambling with few options, and I'm convinced any option will be substantially more expensive. Al says, this train wreck needs to be stopped, and I agree. President Obama and Democrats in Congress made a mess of the health care system in our country. But they said they had a better way of doing things. They said they knew best how to create competition and how health care should operate in America. They created all these Washington mandates. They required people to buy expensive coverage that was more than most people wanted or needed or could afford. Then they created the exchanges where people could buy this new expensive Washington-mandated insurance coverage. And now the people of Wyoming are left with one option on the Obamacare exchange. Buy this insurance from this one company, or the IRS will come knocking at your door to collect a big tax penalty. And, Mr. President, the penalty is going up next year. Because of the significant failures of the Obama administration, rural Americans now have fewer choices. And it's not just in Wyoming. We just learned last week that insurance co-ops in Colorado and Oregon and Tennessee are all closing their doors. Why? Because they've lost so much money. 8 of the 23 healthcare co-ops in the country have collapsed, completely collapsed in the last couple of months. Co-ops have closed in New York, in Kentucky, as the majority leader has just said, in Louisiana, in Nevada, in Iowa, in Nebraska. Many are in rural areas where people already don't have a lot of choice. Now, we're talking about 500,000 people here who are going to lose their coverage, losing their insurance. Now, remember that promise that President Obama made, if you like your coverage, you can keep your coverage? Where's the president now? The president says the health care law is working better than he even thought. Amazing. Obamacare created these co-ops claiming to provide low-cost insurance. Then it saddled each of them with so many mandates, so many restrictions, that they needed massive taxpayer bailouts. Altogether, these failed co-ops have collected nearly $900 million already in taxpayer loans to get help that they needed just to get going. That's how President Obama put this together. Now these co-ops have sunk, others are sinking, and they're taking the taxpayer loans with them. The ones that are trying to survive have been saying, we're going to have to hike our rates. The co-op in Utah plans to raise its premiums by 58% starting in January just to be able to stay open. Is that what the president promised when he said rates would drop $2,500 per family? In Montana, the rates are set to go up 43% for some co-op plans. That's not what anyone in America needed, and it's certainly not what rural Americans need. President Obama said that the American people were going to get more choices, he said, because of his law, instead of getting fewer choices. And yet he stands up and boldly says it's working better than he expected. Obamacare created the illusion of coverage. Now even the illusion is disappearing. What's even worse for rural Americans is that it's not just the coverage that's turning out to be an illusion under Obamacare. The care is actually disappearing. Earlier this month, we learned that Mercy Hospital in Independence, Kansas, will be closing soon. This is the 56th rural hospital to close in the United States since 2010, when Obamacare became law. Another 238 hospitals are in danger of closing. The added expense, the regulations, the other destructive side effects of Obamacare are a big reason for this. The patients who rely on these hospitals will have to find some other place to go to get their medical care, somewhere further away from home. Now, Democrats in Congress, many who live in big cities, may take for granted that they can get to a hospital quickly. It's just not the case in rural America. As a doctor who's practiced medicine for 25 years, I can tell you that the extra time people spend traveling to a hospital, that can make all the difference in the world between life and death. For some who've had a heart attack or been in a traffic accident, or for a woman with a high-risk pregnancy, every minute counts. Only 20% of U.S. population live in rural areas, and these areas account for 60% of all trauma deaths. Americans living in these rural areas don't and didn't need President Obama making it tougher for their rural local hospital to stay open. Mercy Hospital was the center of medical care in the community for 100 years. 100 years, Mr. President, and it's provided jobs for nearly 200 people. In many parts of the country, like Independence, Kansas, and much of my home state of Wyoming, the local hospital can be the biggest employer in the community. If the hospital closes, these people lose their jobs, the tax base for the community goes down, means fewer services like schools, firefighters, public safety. Maybe the local restaurant or florist doesn't have enough business to stay open. Nurses, teachers, and other workers may move away, looking for a better opportunity somewhere else. It's harder for the town to attract new businesses, new doctors, more teachers. The town suffers. Now, that's what these communities across America are facing. Is that what President Obama promised the American people? Is that how Obamacare was supposed to work? Ezekiel Emanuel was one of the president's architects of the health care law. He says that 56 hospitals shutting down is not enough. He's actually written a book about this. It's astonishing, Mr. President. The architect of the president's health care law has written a book, and he says that over the next few years, between now and 2020, more than 1,000 hospitals will close. 1,000 American communities where people will be farther away from medical care. 1,000 American towns in danger because of the lost jobs and lost health care. Mr. President, we needed health care reform in this country. There's no dispute. We did not need this destructive, disruptive, and dangerous Obamacare law. It's been bad for patients. It's been bad for the providers, the nurses and doctors who take care of those patients. And it has been terrible for the American taxpayers. And it's been especially hard on rural communities. We have got to do something to stop this corrosive condition causing hospitals to close, insurance co-ops to collapse, and healthcare choices to disappear. Democrats in Congress need to sit down with Republicans and start talking about the kind of health care reforms that the American people need, want, and deserve.